She knows, you know.
I know.
At Scott's Richmond practice, an extra special little patient is arriving in style.
Gird your loins, Gigi.
Yeah.
We're going in.
Hi, good afternoon.
How are you?
All right, we're here to see Dr. Scott.
Oh, lovely. Who's this?
6-year-old Dachshund Gigi is a familiar face, appearing alongside her doting owners Steph and Dom on Gogglebox.
Well, hello, lovely people.
Ah, there you are.
Steph and Dom are longtime friends of Scott
Welcome to the area.
and have recently moved to southwest London.
Hello, Gigi. How's my girlfriend?
She's not doing
Not
great.
great, I think.
Oh, really?
Either she's pining for you,
Well, obviously, yes.
or there's something
Oh,
wrong.
there's something wrong.
I think there's something wrong.
Dear.
We're very concerned that Gigi is unwell. She's lost a lot of weight. She's just off her game. She seems very lethargic.
Come on, then. Let's go, team. Come on.
Thank you.
Thank you.
We're pretty sure something's afoot, because she is not herself.
Tell me what's been happening.
About a month ago, we were down the New Forest, 6 weeks ago, and she got caught in a rat trap.
Ooh.
You know, a proper old-fashioned mouse trap with teeth.
She's only just a bit bigger than a rat herself.
Unbelievable. We took her to a vet's in the New Forest. We did the bloods, but they found nothing.
Okay. Do you know what it was that was on the trap?
Chocolate.
Oh, okay. Which, as you know, can also be poisonous. So it was good that they checked her over. So that was given the all clear. So
Yeah.
what's causing you concern right now?
She's just lost a lot of weight, even though she's eating. She's lacking in sustained energy. So she will play, but then only for a little bit and then be knackered.
Okay. Well, I think we're just going to take Mrs. Temperature, all right, which you won't be impressed by. Just hold there.
That's the old so much up the bum trick, is it?
I'm sorry, it is, yes. Why don't you give your little girl a kiss and see if she'll be happier?
Don't associate this with me, okay? This is Dr. Scotty shoving things up animals' bums.
She's the only other woman I will let Dom kiss. Just so you know.
Sorry, Scrooge. All right.
Here we go.
Think
Now
of
just look
England.
away.
Think of England,
Lie
Scrooge.
back, look away. Think of grassy fields. Gambling along.
Here we go. Temperature's just fine.
Good.
Girl. Sorry
good.
about that, honey.
Ticking one
Girly.
box.
All right.
Little Gigi has definitely lost her sparkle. This is normally a really sprightly, happy, energetic dog. She looks dull, she looks flat, she looks weak. First of all, I want to look at her liver health because I know that she has consumed potentially something quite toxic and that would damage the liver. So I think what we need to do is to pop her downstairs, we'll take some bloods and we'll just work out where things are going wrong.
Do you have any medicinal brandy?
For you or for the dog?
For me.
Out the back, absolutely, yeah. Yeah. Hey, you can't touch it, young lady.
Need it. All right, we'll see you in a minute.
All right.
All right, I promise you I'll be back soon. I suspect Gigi knows she's not well. I can see it in her eyes. I mean, I promise you.
You know, the bloods will hopefully tell us what's wrong. And hopefully, whatever we find out it is, that it's treatable.
Yeah.
Just around the corner,
Betty will get it. Good girl, Lola. Good girl.
another one of Scott's regular clients, Claire, is getting ready for a trip to the practice.
Good girl.
I have a Sealyham Terrier called Betty. I have a German Short-haired Pointer called Lola, and then 2 Maine Coons, Chip and his sister Chili. The dogs get on with each other and the cats get on with each other, but they don't get on with each other. If you see what I mean. Right, you two, you've got to stay there. You know you're not allowed upstairs. Got to go and see the kiddies.
But today, it's not the dogs, but one of Claire's upstairs feline residents who needs to see Scott.
Boy. So they're 12 years old. I've had them since they were kittens, so they've been a part of my life for a very long time. Chili is bulletproof. She goes to the vet once a year for a check and there's never anything wrong with her. Here we go. Should we give you your inhaler?
But unlike Chili,
Good boy.
Chip is starting to feel his age.
Don't hold your breath. Good boy. He's got asthma. He has a blocked tear duct in one of his eyes, so one of his eyes cries permanently. Right, stick your feet in.
So Claire makes sure Chip has regular checkups.
I get my feet in. There we are. Here
And
we
this
go.
afternoon, he's booked in to see
Boy.
Scott.
Right, let's go.
This is my girlfriend, Gigi. Don't tell Zoe. But she's not very well. Hey, baby.
She doesn't look very well, does she?
No.
Looks a little bit sad.
At the Richmond practice, Scott and nurse Nathan are running tests on celebrity dog Gigi's liver function
Little scratch, sweetie. Oh, brave girl.
to try to find out the cause of her weight loss and lethargy.
When we suspect that a patient has liver disease, we do a blood test, and the blood test will show us if the enzymes associated with liver function are raised, and if they are, it would show that the liver's under stress. Stay there, good girl. Stay there, good girl. Okay. X-ray.
Scott is also performing an X-ray to look for any physical abnormalities in Gigi's liver.
So what we've got here is the shadow of the liver, and it's just quite big. It's quite swollen. It's taking up quite a lot of Gigi's abdomen. So it would suggest that the liver's just plain angry. I can't see any obvious large lumps or bumps in the abdomen, so that's good news.
Blood's all ready, Scott.
Thanks, mate. Oh, no. Look at that.
It's off the scale.
No. They're going to be mortified. Oh, dear Gigi, eh? If only you could read.
Upstairs, Gigi's owners Steph and Dom have been waiting anxiously for the results.
Should be fine. Should be fine.
Hi, guys. No, there you are. It's your girl.
Baby.
Unfortunately, the news is a bit concerning, actually. Yeah, her liver's not functioning very well at the moment. Her liver enzymes are all raised. One of them is so high it's actually off the charts.
You're joking me.
The liver is a really robust organ, and it's actually one of the only ones that's able to regenerate itself. Most of the time, the liver can actually lose about 70% of its function before any clinical signs will be present. So the fact that Gigi is already sick shows how badly damaged her liver really is. There's a lot of different possibilities when it comes to liver disease, and they can vary in scale from something that might come and go to something that's here to stay and also potentially life-threatening.
Oh God, you're making me feel sick.
So where do we go from here?
She's a dog that needs hospital treatment. What we're left with is a liver that's just plain angry, and to determine exactly what's going on with it and how we can best treat Gigi, we need to do a liver biopsy, and that means an anaesthetic and surgery. We need to find out what's going on.
I was not expecting you to say that. It never really occurred to me all this time that there might actually be a serious issue. It literally has never crossed my mind. It's absolutely floored me.
Right, well, we better hand over them.
Yeah.
Okay.
Right.
All right, so...
Well, beauty, you're going to be fine, all right?
Oh, baby.
Take her back to Mummy.
I'm so frightened now that there might be, you might find something absolutely hideous and we can't do anything about it. I think there'll be a day of national mourning.
It's all right, sweetheart.
Scott and nurse Nathan are about to begin surgery on Gigi
Getting you through this.
to find out what's causing her liver disease.
All right, thanks. I'm cutting now. The liver is a complicated organ and it does a lot of different things. And in this instance, it's clearly unhappy about something, whether it's because the dog has eaten something that it shouldn't, whether it's been exposed to something infectious, whether it is harboring cancer. All those things are possibilities. I'm just going into our abdomen now, Nathan. Let's hope we don't find anything too worrying. So first of all, I'm just looking around at all the organs that I can see. So small intestine, stomach, that all looks fine. The liver, it's just very angry looking. It's very swollen. Not normal.
A sample of Gigi's liver will be sent to the lab for testing.
Okay, Nathan, I'm just closing up now. How's she getting on?
Yeah, she's doing well so far.
Yeah, good. Very happy when this is over and she's woken up. This whole procedure, I think I've had my stomach in my mouth. I've been very, very nervous because Steph and Dom are good friends and I know how much they love this dog.
We all want to know what's going wrong with you so I can make you better. Oh, thank you. Thank you.
And now's the start of the agonising wait. We have to send off the piece of liver, the biopsy sample, off to the lab. The pathologist will then have a look and then tell me exactly what's going on with Gigi's liver. It could be something serious, and let's hope it's not.
Gigi will spend the night recovering at the clinic before going home with her owners Steph and Dom tomorrow.
Get you sorted out today. You're probably not going to like it, but it's for your own good. Poor old Chip.
Claire has brought in 12-year-old Chip for his regular health check.
Hello.
Hello.
How are you, gorgeous?
Hi,
You're well.
nice to see you. Mwah.
So the biggest cat in Richmond.
Yes, he's here for his full health check.
His full health check. And look how keen he is. Claire was one of the very first people to walk through the practice doors when we opened 6 years ago. And we've been through real highs and real deep lows. Come on, big boy, in you come.
2 years ago, Claire was walking her 3 dogs on the beach in Cornwall when they were hit by a freak wave. 2 of the dogs, Sprout and Scruffy, were washed out to sea and drowned.
Let me just have a little listen. Good boy. Whenever she comes into the practice, I love seeing her, but I'm always a little bit nervous that I might find something that'll break her heart again. So he's been generally healthy,
Yes,
happy boy.
apart from the ongoing asthma, which you know about, he's been fine.
It's like having a snow leopard in my consult room.
Yes.
So no surprises that he's got a bit of a raspy chest, but that all sounds lovely. Yep. All right, so let's have a little feel of your tummy. All right, big boy.
Good
Sure
boy.
everything's okay. Yeah, I can definitely feel a thickening, for want of a better word, in his abdomen, right up the top there, right sort of near the diaphragm.
What does the thickening mean?
Well, I don't really have an explanation as to what actually it is, because he's not giving us any information. He's not telling us that anything ails him, but clearly I can feel something that shouldn't be there, and that does alarm me. Obviously, Claire's shocked that I found this fibrous tissue. I don't know what it is, and that's really difficult to tell an owner because I know that Claire's immediately going to be very concerned. So, Claire, what I think we need to do with your gentle giant is have him in today and just go on a bit of a fact-finding mission. So give him an anaesthetic to be able to do an X-ray and then see where we're at.
Okay.
Right, so not really the usual general health check kind of fare where I give him a worming tablet and off you go.
He has a history of not breathing under anaesthetic as well, so I'm a bit concerned about an anaesthetic.
Yeah, I mean, him having asthma does complicate matters, absolutely. But if we have to go forward with potentially opening him up, which hopefully we won't have to, but if we have to, of course, he needs to be under anaesthetic.
Well, I was expecting to say, oh yeah, we know he has asthma and everything else is fine and head on home. So, yeah, I wasn't ready for him to have an anaesthetic today. Oh, Chippy. Poor old man.
All right, so
Good
bye,
luck,
Mummy.
boy. And we'll see you later, because you're going to be totally fine.
Say bye, Mother.
Bye-bye.
Good boy.
Hopefully he won't find anything life-threatening, but, I mean, I guess they're looking for tumours, I suppose. I feel a bit sick.
All right, well, let's give you some anaesthetic medication. Yeah. Chip is a very old boy, and he has had issues with anaesthetics in the past, but unfortunately, where this fibrous tissue is so deep and so central that I really can't have him moving at all if I'm to look at it properly. Okay, still breathing, still breathing, good.
Nurse Sam is assisting Scott with Chip's X-ray.
X-ray. Okay, if you keep an eye on him and I'll just run this through. The spectrum of what we're dealing with Chip is pretty wide. There's all sorts of different possibilities here, from completely benign to horrendous. So unfortunately, I can see a shadow, something that shouldn't really be there underneath the stomach. and it's a bit of a mystery. So I think we're going to have to perform surgery. Okay, sweetheart. Let's see what's going on with you.
At her home in Chertsey, practice manager Maz is preparing to bring her 2 tortoises in with her to work.
So this is Alan and Steve. They are collectively known as the kids. And they were actually given to me by my sister because she knew that I was desperate for tortoises and she knew someone who was looking to rehome theirs. So she surprised me with them one day.
Despite their names, Steve and Alan are sisters.
I didn't know they were girls when I named them, but they don't seem to mind. They don't object too much. You don't mind, do you? No.
Maz's fur baby Branston is equally besotted by the girls.
Branston absolutely loves them. He goes up, says hello to them, takes his ball over to play with them and doesn't quite understand why they don't want to chase it. If either of them go missing in the garden or bury themselves under something, he normally finds them and lets us know where they are.
Steve and Alan may not look like the adventurous types, but Maz recently found them in a neighbour's garden, so she's decided they need to be microchipped.
All right, kids. Should we go see Auntie Nathan? Yes.
Today, Maz is taking the tortoises to Scott's surgery to see resident reptile expert Nathan.
And you, Steve.
While they're at the practice, there's another issue she wants Nathan to look at.
Yeah, Nathan, to check your underbite. Yeah. Steve has an underbite, so I like to get Nathan just to check that it's all going well, he can still eat okay. Right, kids? There we go.
Nathan, is our boy doing okay?
Doing well so far.
Okay, mate, that's perfect.
Scott and Nurse Nathan are about to begin surgery on Maine Coon cat Chip to investigate a worrying lump in his abdomen.
I look forward to a day I don't need to anaesthetise this cat again. Performing an exploratory laparotomy is basically unzipping a cat's abdomen and having a look in and just seeing what's in there. Let's see what we find, shall we? Sometimes you'll be surprised and it won't be anything that you should worry about. Sometimes it's a nightmare. It's a very full stomach. That's quite strange. Looking and feeling at this stomach, the stomach does seem angry and there's something in there that feels not like food. It's very solid and very stodgy. Okay, so we're just going to open up this stomach now and see what's in there. Okay. Oh my God, look at that thing. Oh my God, look at that thing. Wow, okay.
In Richmond, Scott has just opened up 12-year-old cat Chip's stomach and made an alarming discovery.
This thing is extraordinary. And it's also something that you don't really see very often. What is that? It's the biggest furball I've ever seen in my entire life. Oh my God. Furballs are produced when cats groom themselves. They swallow the fur and then it accumulates in the gut. This thing is so huge though, he must have consumed that fur over years, filling up his entire stomach. Absolute madness. And it's thoroughly gross. There we go. That's not even all of it. Oh, and it reeks as well. Oh man, it's rancid. Oh my God, it's still coming. Here we go, it's still coming. Oh my God, look at that! Oh, it's like some sort of swamp monster. Jeez, that is unbelievable. You know what? Even though that is thoroughly gross, that is good news. This means that Chip is going to be a healthy boy. So, happy days. Okay. Done. Let's wake the boy up. There we go. That's the problem. Oh.
Laser.
Oh.
Do you think I could have some?
Yeah, you need some. We can do a transplant from Chip to your head. Up until the point that I'd opened Chip's stomach, I was quite concerned and quite worried for Chip's future. In this case, I found something massive and hairy and gross, and I got rid of it. I'm very happy.
Your mummy's going to be very happy, isn't she? Yes, she is. She's going to have a boy for a bit longer yet.
Chip will need to stay at the clinic overnight to make sure he recovers well from his anaesthetic before going home with owner Claire tomorrow.
Good lad.
I cannot wait to deliver Chip back to Claire. She is going to be just so happy and relieved to know that her boy is okay. And then I can't wait to see her face when I show her that hairy baby. She is going to freak out. It's going to be awesome.
Sleep it off. Good chap.
Morning, Gigi. Your butler service is here. Do you want to have a little bit of food?
24 hours after undergoing a liver biopsy, miniature Dachshund Gigi is ready to go home.
Have a little bit of chicken? Maybe not to Madam's taste?
She'll be right. She'll be fine.
I can't wait to see her. Good God.
Hi guys.
Morning, Kirsty.
How are you?
We're all right.
Gigi's owners, TV stars Steph and Dom, can't wait to be reunited with their little girl.
Scott will just bring her up. You want to take a seat?
Thank you.
Okay,
Thank you, will do.
Thank you.
It's all right.
Well, much more upbeat today, because she's obviously not dead.
It felt very odd not having her in the house.
One of us slightly more stressed than the other.
Yes.
Yeah.
I mean, it's because I love her more than you do.
No, you don't.
Yeah.
No, you don't.
I do.
No, I was just cooler about it.
Come on, little lady. I think I can hear Mummy and Daddy upstairs. Come on, then. Good girl.
Glamping, look at that, on the back of a truck. I don't think so. No. Unless I can plug my hairdryer in, I'm not going.
Hi.
Hey, look. Look at you. No cone. Where's your cone of shame? What have we done to you?
I dared not put a cone on such a fashionable creature as young Gigi here.
Oh, she couldn't get closer if she tried.
Oh, Screech.
So now, guys, we do need to just all be patient and be brave until we get the results of that liver biopsy. I've had her on a drip overnight. I've started her off on a special medication to help to manage her liver health, and that seems to have made a difference. But obviously, we all have a nervous wait. Hopefully, it'll be good news and Gigi will make a full recovery.
All right. We'll see you later, Gigi. Be a good girl. Bye, gorgeous.
Try not to worry too much, Dom. Pleasure. All right, we'll see you guys in a few days, yeah?
Thank you.
Okay. Bye. Bye, team.
Cheerio. Thanks very much. Bye.
We're free.
Right. Have
Let's
a nice
go.
cup of tea.
Oh, it's a screech.
Morning.
Hello, love. That's not filing for me, is it?
It's not filing.
Oh, good.
It's a whole other job.
Oh, hello.
Practice manager Maz has arrived at the Richmond practice with some very special cargo.
Should we go down and see Nathan? Come on then.
See you later.
See you in a bit.
Bye.
Nathan's an absolute geek when it comes to anything slightly reptilian, so he's got to be your go-to man when you need something done to your tortoises, that's for sure. Hello!
Hi.
Good, thank you.
So I've been expecting something.
You have. It's the kids.
Ah.
Da-da!
Steve and Alan.
Yep.
So what are they in for today?
Most importantly, microchipping, because Alan started to be a little adventurous with where he's going.
It's amazing how they do escape.
I couldn't believe it.
Yeah.
I never thought having a tortoise meant actually having to keep an eye on them because they could get out quickly.
Yeah.
I sort of thought that was the point of having tortoises, that they couldn't move quickly. So definitely microchipping, please. And then just to double check that Steve's okay with his underbite.
Right. Do you want to do the microchip first?
Let's microchip. I'm ready for this.
Excellent.
I am your assistant.
So obviously normally in cats and dogs we do it in between the shoulder blades.
Yeah.
Might be a little bit hard.
Yeah, fair enough. I see where you're coming from.
Yeah. So in tortoises we normally do it in the hind leg, in the
Okay.
left hind leg, and it goes just above there.
I've never seen a tortoise get microchipped before, so this is brand new for me.
So it's really important that we microchip them now. Like anything, especially something you keep in the garden, no one knows quite how they disappear, but it does happen occasionally. And I think now having the microchip gives that a little bit of security There you go. If they do go wandering, then we'll be able to find them.
With the microchipping complete, Nathan can now address Steve's underbite.
So that's quite impressive, that.
It's quite an underbite.
An underbite is caused by an overgrown lower jaw, which can make eating tricky.
I can see she goes towards food, but pushes it away because she can't actually grip to it.
Yeah.
Maz wants to make sure Steve's underbite isn't stopping her from getting enough food, especially with hibernation season approaching.
So what I think I might do is just take a little bit off there, just off the bottom beak, just to help her eat and make it a little bit easier.
So it's more of a closed mouth rather than there being an obvious underbite to it?
Yeah, so instead of having like a shovel and having to eat over the shovel, she should be able to eat a little better.
Okay, yep.
To trim the beaks, I'm going to use a dental machine and a burr which we often trim rabbits' teeth down with. So I need as still as possible.
Okay, I can do this.
Trimming the beak doesn't hurt at all. I guess it's just like cutting your fingernails. It just takes the edge off of it without drilling too much away. Perfect. But I think you can see already that there's...
You can see, from the top you can see.
Yeah.
It's not that scoop like you were talking about.
Yeah.
So I think now you've got a better chance. All done, tortoises are chipped and clean bill of health and they're both good. They're ready to enjoy the rest of the summer before they go back to sleep again for a few months. All right, say thank you to Auntie Nathan.
Thanks.
Say thank you. Mwah, mwah, mwah.
Later that day, Scott is on his way between practices when he receives an urgent SOS.
So I've just had a call from one of my nurses, Nathan, up at Richmond. He said he's just admitted one of our patients, Freddie, who is in a really bad way. He's just gone under about 3 or 4 cars and he's really unwell, so I'm heading up there now. Come on, let's get there.
Nathan is closely monitoring the 3-year-old Italian greyhound until Scott arrives.
Just downstairs.
Freddie's all right?
Good.
Hey, Nate.
Hi, Scott.
What do we got?
His temperature's 36.5 at the moment, so I'm just trying to bring that up. I put him on fluids. His oxygen level's low in his blood as well.
Freddie?
His eyes are really red as well, where the blood vessels are burst.
Look at that. There's a huge amount of bruising around that eye. That's really bad. He's bruising even in his ear. Look at that. So poor little Freddie is really in a terrible state. He is very, very flat indeed. So I'm very concerned this dog has suffered some kind of head trauma. Oh my God. Look at how bruised he is. Poor boy, poor boy. Oh, that hurts a bit, doesn't it? Okay, okay. It's all right. Your mummy must be so worried, eh?
Anxiously waiting upstairs is Freddie's traumatized owner. Ivona was walking her 6 dogs in a local park when Freddie escaped.
I didn't even know he'd gone. A passerby said to me, "Have you lost a dog?" And because one's just been hit on the road, I knew it was him immediately. So I raced over to the gate. And as I'm standing there, absolutely hysterical, the dog got hit by 2 other cars. And then one truck went over him, and another truck. So I thought, well, the dog's dead.
Just then, another passerby came to her aid.
This guy literally stepped out onto the North Circular in the rush hour, arms up, stopped the traffic, and scooped him up and said, "He's alive, he's breathing."
Scott now urgently needs to x-ray Freddie to look for any head injuries and also see if there are any broken bones.
Oh, it's just awful, isn't it? Hey, poor boy.
With Freddie laid out on the X-ray table, you can really see the full spectacle of what this accident has caused this poor little creature. He is so covered in bruises. I don't think ever in my experience have I seen a dog so bruised as little Freddie.
So Nathan, I'm just going to take an X-ray of his head and neck. So just spin him around this way. Good boy. X-ray. So this is the fragment of bone there, and there's just a line here that I don't like the look of. So the wheels have likely gone over the top of him and have fractured his pelvis. But the fact that none of his other limbs are broken is incredible. But the biggest concern for me now is why Freddie is so very flat. And I think the problem is within the brain itself. Okay, come on through. Here's your boy. He's still very sad.
Oh my God.
Who's that?
It's horrible to see him the way he is.
All right, okay. The good news is there's no fractures or broken bones in the head, in the neck, which is great.
Amazed.
But he does have fractures in his pelvis, I'm afraid. I'm hoping that just with time and rest, they may heal on their own, but we'll have to wait and see. What I'm majorly concerned about is the fact that he is so weak at the moment. We can't assess what other neurological symptoms he may have. He can feel all of his limbs, but he's certainly not moving all of his limbs. And so until he starts doing that, we won't know what damage has been done.
You silly boy.
Freddie will need to remain at the practice until the extent of his brain injury becomes clear.
I just don't know how badly damaged it'll be. It may be that it permanently affects the ability to walk, his memory, even his personality.
Oh, Fred. I know. You're gonna have to stay here for a while, buddy. Yes, you are.
Hello, mate. Hello. Wow, look at you. Hello, buddy. Hello, sweetheart. Gosh, you're looking better, aren't you? Look at you, trying to use your legs. Hey? Mwah.
2 days after Freddie's road accident, Scott is checking on the Italian Greyhound's progress.
Look how much brighter this boy is today. Hey? Yeah, he's a little bit sore still, which is why he's panting a little bit. But, I mean, look at him. He's standing. Look at how bruised he is. Oh, that hurts a bit, doesn't it? Okay.
The 3-year-old ran into busy traffic and was left with a broken pelvis and extensive bruising.
Good boy. It's all right. I just want to do a few neurological tests on his body. Good boy.
While the pelvic fractures should heal over time, Scott's worried the 3-year-old may have swelling on the brain, or worse, a permanent brain injury.
Come here, sweetheart. Okay.
So he's doing some tests to check for brain activity.
Okay, ready? Just see what you're doing here. Good boy, well done. What I'm doing is just putting his knuckles on the ground and just seeing if he'll right the foot. Good boy. Okay, so this is the one that I'm concerned about. Good boy. But the right hind leg is a little slow to right. Now, if it was that he's had major trauma on the right-hand side and there's been some swelling to the nerves, that swelling can impede the ability of the impulses to get to the brain. But with a reduction in the swelling, hopefully we're going to see the nerves talking to the brain again.
Scott now feels the best place for him is at home with Ivana.
He's improved so much that I think Scott's going to let him go home with me tonight. So I'm really, really happy. I can't wait to see him.
Hiya.
Hey, Fred!
This is your boy.
Fred, stop. Hey, gorgeous boy.
Hey, who's that? Who's that? He's so much brighter.
It's just...
It's a miracle.
Yep. To come from the dog lying in the road with cars hitting him and 2 trucks going over, to here in the space of a few days is just incredible.
You know, massive strides. But one thing I would say is brain injury can, of course, change personalities alongside cause numerous neurological problems. So what we need to do is just be patient and let these next few days and weeks run through, and then we can work out, does he have long-term issues that we need to manage? Ivana's a very practical owner. She understands that her dog has suffered a major trauma and he's not going to get better overnight, but hopefully everything is starting to come back. All right, so you get home and get well, and I'll see you very soon. Yes, I will. All right, Ivana.
Okay, brilliant.
All the best.
Thanks very much.
No worries.
Thank
It's
you.
been a pleasure. Bye, sweetheart. Bye.
He's looking more like Fred now than he was a few days ago. Fingers crossed that he makes it to a full recovery.
Another client, Claire, is also returning to the Richmond practice, excited about picking up her boy Chip after his big stomach operation.
I can't wait to see him. Really missed him overnight. But I'm happy to know that he's okay. So yeah, really looking forward to getting him back home.
Should we go see Mummy? Come on. Ready? Oh, he's a big boy. Oh, he's a big boy. Come on. Oh.
Yeah, the anticipation is huge. What is in Chip's stomach? So yeah, I need to know the answer.
Hello.
Hello.
There's your boy.
There he is. Hello. How are you doing? Oh, I missed you.
Go on then. Do you want to have a cuddle with Mummy?
Come on then.
Come on, you big lump. There we go. You got him.
There he is. Oh.
So what is in his stomach?
I think you need to see it with your own eyes.
Okay.
So just give me 1 second.
Oh, Chippy Chip. What have you eaten? What's in your tummy?
So my jacket will give you a little bit of a
Yes.
hint as to what this is.
Oh!
It is the biggest hairball I've seen in my entire 20-year career.
Yeah, you were never going to get all of that out the normal way. It's such a relief that it was just a hairball, albeit a very large one, and I don't need to worry about cancer or any other threatening illnesses.
Which brings me to my next suggestion with regards to his treatment, which is
Shaving.
he needs a new do, the boy. He needs a new
No,
do.
I was joking. You're not seriously going to shave him.
He needs to be clipped. We don't want this to happen again.
I'll brush him more.
You'll brush him more?
Seriously? I'm not shaving him.
We brushed him this morning. Claire is honestly one of the best owners that we have. She does everything I ask to the letter. But this time around, there was definitely a little bit of pushback. Just a new haircut for summer, you know?
Not convinced by this. Usually I agree with everything you say immediately, and I'm not.
The first time we fallen
out. I know.
I certainly wouldn't be recommending a new hairstyle for Chip without good reason. So if we can just reduce the amount of hair he's covered in, I think that he's going to ingest less, and therefore I won't need to go back in and remove another monstrous hairball. Come on.
Let's get you home.
Mummy needs to organise that hair appointment.
Oh, well, think about that. I will consider the shaving because I can see that it's going to be best for his health.
Boy.
Yeah, I'm really not happy about cutting off all his lovely fur, though.
Bye, Chip.
Thanks.
Come on.
Beautiful, big,
Let's go.
hairy boy. I mean, look at me, honestly.
Thought you might need that.
Good plan.
Might help.
She can tell, you know.
I know, she's shivering. She's not the only one, it's cold.
Little bit chilly.
Come on then.
Come on.
Here we go.
Hello.
Hello, hello, hello.
Hello, you two. How are you? You're right, nice, sir. Good to see you.
And you?
3 days after the liver biopsy on Dachshund Gigi, her owners Steph and Dom are back at the practice to hear the results.
I have a report on you, my love. So
really?
I think Mum and Dad will be quite interested to hear. Ooh. Wow, that's ominous.
Jeez, Louise, what are you going to tell me?
Come on, let's go.
I'm personally quite terrified to hear what the results are because I've got a bad feeling about it because I've seen Dr. Scott's face and you can read his face, I think, very well, and he's as worried as I am, so I don't know, I haven't been able to sleep very well.
So I know you've been putting a brave face on, but I do have the report regarding the biopsy we took on little Gigi. And the news is good. There shouldn't be any lasting issue.
Oh, thank
So,
God.
there you go.
Thank you.
Sweet, you're going to be all right, my
Oh,
darling.
my God.
Yes. So I'm hoping that although Gigi has swallowed a little morsel which is toxic and has damaged her liver, given time and the medication I've prescribed, her liver should return to normal function. Thank goodness for the regenerative powers of the liver, and I couldn't think of two better people to advocate that.
Well, the irony is quite something, isn't it?
Could I have some of those pills, please? The relief is unbelievable. She's fine. She's absolutely fine. She's obviously ingested something really horrible. God knows what that is. But there is no cancer. There's no awful stuff lurking in the shadows. So we're going to go to the pub and celebrate.
All right, guys.
Thank you so much.
There you
A little celebratory drink.
I think so.
But not vegan,
Yes!
squeeze.
Let's go to the pub.
Come on, you're okay.
It's now 7 weeks after Greyhound Freddie's accident, and the 3-year-old is defying the odds, not only surviving the crash, but also showing no signs of any permanent brain damage.
Freddie, good boy, Fred. It was touch and go, totally. We didn't know whether he was going to survive, but he's recovered fantastically. He's brilliant. I mean, we can't believe it.
Scott is anxious to see for himself the brave dog's remarkable recovery.
Well, hello.
Hey.
That was an enthusiastic welcome.
Yeah, hi.
How are you? Hello,
good,
puppy.
thank you.
Hello, Fred. Wow.
Yeah, as you can see, he's
He's doing all right, isn't he? Hello, mate.
racing around.
Wow, the fact that he's walking, amazing. As soon as I'm ushered into the house, immediately I can see Freddie, and he's doing so well. He's walking really well, he's running around, it's brilliant. So he seems none the worse for wear considering such an extreme injury.
Yeah, it doesn't affect his function at all.
Certainly personality seems unaffected,
yeah.
and that was the big thing. Is
That was the big worry.
Yeah, we didn't know, would he have a complete shift in personality? Would you say that he's just the same old Fred?
Yeah, he is the same old Fred. Yeah. He's back to full capacity and back to normal, at least sort of 98%. So yeah, everything's great. Well, it's pretty magical
Well,
what you and your team have done.
Oh, thank you. It is a miracle, really, that this dog is here when 7 weeks ago he was literally on death's door. So it is a wonderful result. I'm really glad to see he's happy and that Ivana is as well. All I'm talking about with you, young man, is road safety for dogs.
Scott's also making a home visit to see Maine Coon cat Chip, curious to find out whether owner Claire has followed his advice to give the fluffy feline a haircut.
Hello! How are you?
I'm good, how are you?
Absolute madness.
Exploratory surgery revealed an enormous furball lodged in Chip's stomach.
Oh my God, look at that!
Here he is.
Hello, mate. I think he looks awesome.
Well, it's better than when I thought you wanted me to shave him naked.
Oh, I think he looks fantastic.
If I had my way, and if he didn't have hairball problems, I wouldn't have touched his hair. But I've cut it short, but not too short. So hopefully that will solve the problem.
So what you've done is reduce the amount of hair living on this cat by probably 2/3, I would say.
Yeah.
Let's not forget the size of the furball that I removed from Chip. It wasn't just a tiny little thing. This was massive. And as a result, we need to change the amount of hair this cat consumes to avoid it from happening again.
He may not
gritted
look quite
teeth.
himself, but I'm sure it's for his own good.
I love it. Through gritted teeth. You're thinking this is an okay idea at
It's
best.
okay, yeah.
Well, I think he looks great, and I think the hairdo suits him, mate. But I'm just really glad
He's
you're
still got
healthy.
his beautiful face.
Scott's on his way. Poor Obi.
Oberon is so unwell and struggling to walk, his owners, mother and daughter Sue and Susanna,
He's a good boy.
have asked Scott to make the special house call.
Hi, Sue.
Hi, Scott.
You're all right.
Thank
What's
you so
up?
much for coming so quickly.
It's okay.
Come in and see Oberon. He's really not very well.
Okay.
Please come in.
All
Thank
right.
you.
Will do.
Oberon's in here.
Hi, Obi. Hi, Susanna.
Hello,
How are you? You're all right?
Thank you. How are you?
Hello, champ. What's been going on?
Last Sunday, he went out into the garden and collapsed in the flower bed. It started off with a choke.
Yeah, and then his gums went pale and then it was going blue and he wasn't breathing.
And it was an awful, awful, desperate situation. We thought we might actually even lose him. So it was really frightening.
I can imagine. Yeah. And has he shown the other symptoms that have carried on?
Yes, well, when he gets a bit agitated, especially when there's food around, he's expecting to be fed, he sort of starts jumping about. And then he finds it difficult to breathe and starts coughing a bit. So yes, we're very worried about him.
Has his bark changed at all?
Definitely, he's become more hoarse.
Yes, much hoarser, quieter, yeah.
Yeah, it's not as loud as bark anymore.
Yeah.
Okay. Well, there's a number of possible respiratory conditions. There's some cardiac conditions, of course, it could be. But the concern that I have is that he may have a condition called laryngeal paralysis. He's got all the classic symptoms and also he's got an old boy, and it does tend to happen in older dogs as well. The larynx is the cartilaginous box, the voice box in the throat, and the nerves that supply it sometimes fail to work. And as a result, the larynx is then unable to open properly to allow a decent amount of air into the lungs. So it means not only does his bark sound different, but he's actually unable to open his airways up enough to take in enough oxygen. So any form of heat or any form of stress leads to this old boy having some problems. Hey, buddy. I think the fact that Oberon has collapsed in his very own garden, just doing what old dogs do, which is not much, is incredibly concerning. And I do feel that I need to take him to the practice to understand this condition more and work out exactly what we're going to do to fix it. Good boy. Out we go. Come on then, buddy. Come on.
We've had Oberon all his life. We got him when he was a puppy. If we lost Oberon, I think we would be absolutely heartbroken. We know he's an old boy, but he's so loved and he's part of the family.
Let's go to the practice. Good boy.
Don't worry, darling, be all right.
Jack, come here.
Jack, can I have that ball, please?
Come on, puppy. Go on. He's a good birthday boy.
At a local park, it's Springer Spaniel Jack's birthday, and he's enjoying a play in the sun.
Good boy.
With his devoted owner Francine
Oh, he's nearly got it.
and her partner Joe.
It's behind
Jack,
you.
where's the ball?
Jack.
Where's the ball?
He's 12 today. We adopted him when he was 6 months old from a sanctuary back in Oxfordshire.
Good boy.
I was about 13 at the time. So I've grown up with Jack.
But birthday celebrations have been put on hold because Jack needs surgery.
Good boy.
Jack's always been a really healthy dog, but when he was about 4, he developed a fatty lump on one of his back paws.
Good boy.
We've been told that those lipomas, they're harmless, so you can just leave them unless they're causing other issues.
Go on then.
Oh, you're excited, aren't you?
He's had quite a few pop up over the years.
But now I think the ones on his shoulder are getting so big that they're getting in the way of his legs and his walking and things.
Go on then, Jackie.
Francine is terrified at the prospect of her much-loved boy undergoing surgery after a previous scare.
Good boy.
It was the anaesthetic he reacted to. He was out of it for quite a few days. So he'd get up to walk over to you and fall over or vomit. It wasn't very nice. He was really poorly.
Come on, Jack.
Jack.
Let's go for a nice walk.
I'm really nervous about taking him to vets. He's my only Jack. Jack means the whole world to me. He's my best friend, no offence. And I don't know, I just can't imagine not having him around. I love you, Jack.
He is our extra housemate.
Yeah, massive part of the family.
Jack has an appointment with Scott tomorrow for the lipoma surgery.
You gonna be a good boy tomorrow, Jack? He's a good birthday boy. Good boy.
Be careful when you're picking him up, but we need him up here on the table, please.
Okay.
Good boy.
Come on,
Yay, good lad. Well done.
At the Richmond practice, Scott needs to find out why elderly dog Oberon collapsed at home and has been struggling to breathe.
So we're going to have to take some of your blood, and then we're going to try and do some x-rays. Okay, good boy, good boy, good boy.
Nurse Nathan will be assisting with Oberon's tests.
Good boy.
Chilled, aren't you, hey?
That's it. Good boy, Obi. Well done. Well done.
Scott suspects the 13-year-old's breathing difficulties may be due to a paralysed larynx.
Right, okay, sweetheart. Good boy. Stay still. Big boy.
X-ray.
Yeah.
But first, he has to rule out any other possibilities.
Just taking some x-rays of Oberon's chest just to see if there's any reason for his sudden collapse and his respiratory issues. So his lungs are pretty clear. His heart looks normal, so the problem isn't in his chest. Blood through yet, Nate?
Let's bring them up.
Wow, he's a pretty healthy boy. Looking at the blood test, generally, Oberon's an incredibly healthy boy for 13. I mean, it's a great old age for a Hungarian Vizsla. I hope our blood's looking like that when I'm his age. It's pretty good. Doing the x-rays and all the blood testing that we've done has basically ruled out every other possible cause of Oberon's respiratory distress besides laryngeal paralysis.
Scott is hoping to avoid surgery on the elderly dog, so he's called his good mate, specialist surgeon Michael Hamilton, for a second opinion.
Hey, Scotty.
Hey, Michael. How are you, mate?
Yeah, I'm good. Oh, he's not as bad as I thought he was going to be.
Well,
you're paying for my speeding ticket, mate.
Fair enough, fair enough. Well, his owners are pretty worried. He did collapse at the family home a week ago.
Yeah.
And he's showing some fairly classic signs of laryngeal paralysis. So his bark has changed. He's doing a strange sort of throat clearing.
Yeah.
And every time he gets excited or stressed, he starts having issues with his breathing and struggles to get breath.
Yeah, change of barks, highly suspicious.
Yeah.
Can I just have a quick listen to him?
Absolutely.
Yeah, he's pretty raspy around his larynx, isn't he?
Good boy.
He's nice and relaxed on his meds, isn't he?
Yeah.
But a little charge around the park and he goes blue, right? Yeah.
That's pretty much it.
You got his x-rays and things?
Yeah, so we've taken some chest x-rays. They all look fine. But what we need to do, of course, is give him his anaesthetic. So I thought I'd wait for you.
Yeah, and have a look.
Before making a decision on whether or not to operate, Scott and Michael need to have a close look at Oberon's larynx to see how well it's functioning.
Okay, sweetheart.
For this, he's been given just a light anaesthetic.
To fully assess Oberon, he needs to actually be awake, which does mean that he can bite down on our hands as we're checking him over. Watch your fingers, because it's going to be quite light,
He will be chompy, so...
Okay.
So look. So when he breathes in, what should happen is his airway should open.
Yeah.
If it's paralysed when he breathes in, he sucks it closed. So, Nath, tell me when he's breathing in and breathing out. So go in and out as he breathes in and out.
In, out. In.
Yeah, it's not doing much.
In.
Looking down this dog's airway, there's no movement at all. And so as he's trying to breathe, his airways should be pulled open. But actually what happens is they just sit there. And as he breathes and sucks air in, they actually get sucked closed. So he's got bilateral, both sides, paralysis of his larynx. And dogs can die from this. So it's a bit of a ticking time bomb.
Right, so surgery it is then?
Yeah, sure. Right.
Okay.
I'll go get changed, mate, if you go get tube.
We'll do.
See you in a sec.
All right, see you in a second.
Oberon will now be given a full anaesthetic, and Scott and Michael can immediately proceed with the delicate surgery.
The procedure that we're going to be performing today is called a laryngeal tieback. It's a very complicated procedure, and it comes with lots of risks.
I'll just be there to tell you to cut that cricotrycnoid.
Yeah.
That's the only scary bit, really.
Today I'm going to be the lead surgeon, but Michael is very much my able right-hand man.
So keep feeling for that wing of the thyroid, because that's basically where you're aiming. That's where you need to go to. There's some big things in there, jugular veins, big nerves. So yeah, you just got to make sure you know where you're at.
I'm ready to go.
Go for it, Manny. Stage one, rule one, don't cut the jugular. Go for it, Manny. That's it.
Just want to cut that.
Yeah, and then a little bit backwards.
In Richmond, Scott and specialist surgeon Michael Hamilton have started life-saving surgery on 13-year-old Vizsla Oberon.
So there's some decent vessels in here, so just be careful.
The elderly dog's larynx isn't opening properly, and he's been struggling to breathe.
See that little fella?
Yeah.
Don't want to cut that.
No.
That's the branch of the jugular, so I'll get him up here out the way. There you go.
The procedure is something called a laryngeal tieback. It's incredibly complicated with a whole bunch of muscles and a lot of really important blood vessels and nerves around. So it does make for a very risky surgery.
Now for the really scary bit. So you've got your process there. And if you put your finger just behind that muscular process and there's a little depression, that is actually the joint that you're going to disarticulate. And then we're going to stitch the arytenoid in a different place.
Yeah.
But it's quite a tough joint, but it's a joint nonetheless. You need to just free it up a little bit. So just use your forceps on there and then just cut forwards just a little bit. That's it. That's lovely. Nice work, sir.
So we're at a pretty pivotal stage of the surgery. What we've done is separated the inner bit of cartilage, which means that I can now grab hold of the muscular process we uncovered and actually then lasso it to that middle cartilage. And by doing so, we're opening up the larynx and pulling away that vocal fold away from the centre.
That's it. Nice. So you just got to tie it now and that's it.
Yep.
I'm just going to hold that ever so gently like finger on a parcel. Done.
Nice.
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 Happy with that.
Nice,
Or
mate.
as the Geordies say, lush. So there is our laryngeal tieback, a massive surgery with lots of complications, and all it boils down to is just one little suture that's going to make all the difference in the world.
Good job. Looking good.
I'm just closing up, so yeah, Oberon says thank you, and so do I, but you can head off.
No worries, no worries.
Thanks, mate.
Okay, all good. Mate,
Nice working with you.
I'll see you soon. Bye, mate.
See ya.
It went well. Didn't cut any white stringy things, as in the nerves. So best case scenario, future for Oberon is he will wake up and can't believe how well he can breathe. And within a couple of weeks, just when everything's settled down, he's flying around the park like he never has done before.
Okay, now to see if the job's done. Oh yeah, look at the difference, that's massive. It's a massive relief to actually see that his larynx is now much more open. This is an old boy that's had a great life, and I want him to have a life going forward. And he can only do that when he has an open airway. And now, thankfully, he does. That was a long one, wasn't it, mate? Hey?
Oberon will spend the night under observation at the clinic to make sure he's fit enough to go home to his owners in the morning.
You huff and you puff, old boy, eh? At least you can breathe now. Yeah. No more collapsing for you.
Nathan, look at the baby.
Downstairs at the clinic, new mum Ellie and her two fragile newborns are getting some TLC with nurse Nathan and practice manager Maz after being brought in for a health check.
That one's a bruiser. It's the bigger one. I make you.
Ellie's owner Victoria has had a worrying few hours, concerned that the new little arrivals aren't feeding properly.
They are pretty small, or one is especially. So, yeah, I'm quite nervous about that.
The young Bichon Frise gave birth overnight.
Good girl, Ellie.
But so far, her two little pups have been unable to latch on by themselves for their all-important first feed.
Come on, Ellie, look. Gonna feed the babies. Come on, sweetie, see if you can do it. Oh, good girl, Ellie.
So Nathan and practice manager Maz are helping out the first-time mum.
That's it, just a little more down there, sweetie. Come on. Oh, nearly.
You got it? Yeah, well done.
Got it. Oh, there we go. It's amazing. No one teaches them, and she's there feeding her babies. It was all just this really beautiful thing to actually witness. We got them both on?
Yeah, that's two.
Holding those tiny pups is just like nothing else. They're small, their eyes aren't open, they're just brand new, tiny little balls of yumminess that you just kind of want to squeeze harder than you should.
With the pups now feeding well, a delighted Maz can't wait to show owner Victoria the hungry little boys.
Hello. Wow. Thank you. Oh.
Proud mummy moment.
Yeah. Hey. Well done.
Been a very good mummy.
I'm very proud.
To walk out my office and see this beautiful mum with her two lovely tiny little puppies, it would make anybody's day, but I've got to say it's the perks of the job that you get every now and then, just getting that little insight into brand new life in the world.
With full bellies and a clean bill of health, the contented pups are now ready for a snooze. The new little family will head home with Victoria later today.
Well done.
Such a clever girl.
Oh, yum. Good boy, well done. You're breathing very well this morning, aren't you? Hey? Yeah.
Oberon is recovering well from his big surgery.
Good boy. Hey? Wouldn't know you've been through a major surgery. Hey, no you wouldn't. No.
Yesterday, the 13-year-old Vizsla underwent a risky throat operation to correct the paralysed larynx that was closing his airway.
Yes. Wait a minute. There we go. You got very nice table manners. Good boy. Yeah. Take it nice and easy. Yeah. Mummy and Grandma will be here soon.
So excited about seeing him. Yeah.
Owners Sue and Susanna have arrived at the practice and can't wait to take their old boy home.
Hello. Hello.
How are you doing?
We've come to pick up Oberon.
No problem.
Yeah,
Oh,
thank you. Thank you very much.
All right, cheers.
Last night was terrifying. We were really nervous, waiting to hear how he was, how he's pulled through. Can't wait to see him. So excited.
Who's this?
Here he comes. Oh, sweetheart. Hello.
Hi, guys.
Hi.
Oh, and here's your boy.
Hey, baby.
Hey.
Hello, baby.
Oh, yes.
Hello.
Who's that?
Okay, my lovely.
So he's done very, very well. He's obviously going to still be making a little bit of noise after the surgery,
Yeah.
just because of the fact that he's had a tube down his throat and also major surgery on his neck. But I'm very happy with the result. The surgery went really well, and now his larynx is tied back on the left-hand side. So it's basically like if he's got sliding doors, one sliding door is now pulled in the open position all the time. Now that Oberon's going home, he does need some very specialised care because basically he has an airway which is permanently latched open. So he is exposed to the possibility that he could breathe in food and cause severe distress. And so one thing Sir will be requiring is his food needs to be now hand-fed.
Yeah.
You need to roll it into little balls and he's going to be fed at head height. So you get the royal treatment you are, yes. Hand-fed by your own personal butler service. Yes. But other than that, this old boy should make a full recovery and be bounding around the parks of Richmond very soon.
It's such an almighty relief, isn't it?
Hey, you're not perfect, but you can breathe.
Yeah.
And that's all we want. That's all we want, isn't it? Yeah. All right. Bye, buddy. Take care. We'll see you soon. Bye, buddy. See ya. Bye. See you later. Take care. All the best. See ya.
Thank you so much.
Bye.
Bye-bye. Come on, boy. Wait, come on, this way. Come on. That's a good boy.
Come on then, Jack.
Francine and her partner Joe
Take you out for your big day, Jack.
have arrived at Scott's Richmond clinic with 12-year-old Jack.
Hi, guys. How are you?
Good, thank you.
And this must be Jack.
This is Jack.
Hello, mate. I hear it was your birthday yesterday.
Yeah.
And look what Mum and Dad got you, a vet visit. Right. Well, shall we go into the consult room and have a little chat?
Come on, Jack.
Come on, then.
Good
Come on,
boy.
buddy.
Come on.
I didn't really sleep very well last night, so anxious about what was to come today.
Okay. I'm just gonna get him to stand up for me. Good boy. Yeah.
It was a long journey here. The whole time on the train, I sat on the floor and cuddled him. I was just so nervous.
So obviously he's got lots of lumps and bumps everywhere. How are they affecting his quality of life?
They weren't, but this one in particular has gotten so big, he gets a bit limpy.
Right.
And you can tell he's uncomfortable in certain positions when he's laying down.
Yeah, that's fair enough. I'd be uncomfortable if I had that big lump there.
Yeah.
I'm not concerned about what they are. I'm pretty certain they're going to be benign. But the only issue with them is when they're just getting in the way of normal function and movement. And I think that's exactly what's happening. Is that one there, he's got like a big football on his shoulder, and so he can't actually extend his leg forward. And he's also got this one here, which might be doing the same in reverse, actually, because it's sort of over his shoulder blade there. What I'm finding on Jack is very large lumps of fat growing on his body, and those lumps are called lipomas. That's a benign type of tumour. They're causing a change in the way that he walks. And for an old dog, that's a problem because it can encourage arthritis.
I think if we can get rid of that, he can have a good quality of life in his twilight years.
But of course, we have to address that not small issue of anaesthetics in old dogs.
Yeah, he had a lipoma removed actually when he was about 4, but he didn't take too well to anaesthetic. He was quite unwell, sort of being sick, couldn't really walk straight, so it was quite a worrying time. So hence why I haven't had any of them removed so far, because they've not been causing him too much trouble, and I just don't want to risk losing him.
Yeah, so now it's become critical mass.
Yeah.
And it's forcing you to make that decision, but I can see in your eyes you're quite nervous, aren't you?
Yeah.
It's better if we just be strategic, work out which ones are the most important and which ones could wait. So I think that one and that one, big enough on their own, but I would definitely try and remove both of them.
Yeah.
I just think we don't want him to grow old and be in discomfort.
No, exactly. Yeah.
Yeah, yeah. Says Mum with a worried look on her face.
She's scared, you can tell, can't you?
Jack's not had an operation for a really long time, and now he is that bit older, I just worry so much about him. So my stomach's in knots, really.
I appreciate that you have trust in me regarding the anaesthetic.
Yeah.
But I appreciate it's a big thing for you guys. So you need to say goodbye to your boy.
Okay.
Oh, Jackie.
Bye, Jackie. The pressure's really on for Scott, because this boy means a lot to us. He's 1 in a million, and he's got to save my boy.
Come on then. God, I'd say he's a big lump, but I think it's a bit rude because he actually has some lumps.
Wow.
Don't you, mate?
Who's this?
This is Jack, and Jack has some lipomas, which you can very clearly see. Yeah. So we're going to take them off, aren't we? Yeah, okay. Let's get going. Now, just so you know, with this guy, previously he's had a bit of an issue with an anaesthetic. He struggled to recover, so we do need to just be quite careful about what drugs we use.
You never give me easy anaesthetics, can I just say that?
Well, you're very good at your job, Nathan, so I think you need a challenge. Just give him a breath of air. No?
Seconds later, Scott is suddenly alarmed.
Come on. He's not breathing. Just give him another breath of air there. As the seconds tick past, my concern is rising because at any point his heart can stop. Come on, mate. Come on. Come on, mate. Heart's still strong because it's not breathing. Yeah. Come on, mate. Don't be lazy. Come on.
In Richmond, elderly Springer Spaniel Jack has stopped breathing just moments after being given anaesthetic.
Just give him another breath of air there. This is an old boy. He responded badly in the past to an anaesthetic. He's doing the same thing again, even though we're using different drugs. Let's just flip him over and see if that makes a difference. Yeah, so we're just giving him some oxygen because he's just not breathing at the moment. So we just need to keep trying to encourage him to do so. The longer this process goes on, the more concerned that Jack simply will not survive this anaesthetic. Come on.
Oh, there we go.
There we go.
Yep.
Oh, bloody hell. I felt like I held my breath for about 3 minutes then. I'm like a deep water diver. It's been a very stressful 3 minutes. I've definitely got more grey hairs, and Nathan's definitely lost more hair as a result of this anaesthetic. I think we need to just work quickly, get these lumps out as quickly as possible, and watch him like a hawk. Okay, so cutting.
Scott is removing 2 massive lipomas, or fatty lumps, from Jack's shoulder.
Look at that. Wow. It's a whopper. So you can see now it just wants to come out. It's like a nasty pea in an inappropriate pod. Come on. Here we go. Look at that.
Wow.
Huge. So that's one done. One to go. Here we go. Wow. Another absolute whopper. So no wonder he's sore, because it's actually stretching the muscle above it. So to remove this is going to make a big difference to the quality of this dog's life. It's massive, isn't it? That. It's pretty weighty as well.
Bit of weight loss surgery there.
Yeah. Okay, closing up. Interestingly, the lipomas, they were growing within muscle, which means that they would be causing quite a degree of discomfort. So actually it's incredibly rewarding to remove them, because I know that Jack is going to wake up a far happier and more comfortable old boy. You gave us a bit of a scare there, didn't you? Yeah, massive relief to have this guy awake. He was a challenge, I think is fair to say, but worth it, because he is going to feel so much better now those lumps are out, and so am I. He's like, I'm still disappointed about this as a birthday present. That is an awful birthday present surgery.
Oh. I think we all deserve some cake after this.
I think so. Come on.
Jack will sleep off the anaesthetic before going home later today.
Good boy. Thankfully, Jack is waking up very, very nicely for an old boy, but this anaesthetic is done. I definitely think that Nathan and I have earned a beer tonight. You good boy. You can't have a birthday without a beer, can you? Nope, you can't.
Hey, Scott.
Hello, mate.
I've got a present for you.
Oh, you shouldn't have.
I've had these left on the doorstep, and I'm hoping you can do something with them.
Okay, well, sounds like a bird, at least. Should we have a look and see? Wow. I've got a good idea what species of bird they are.
Vet nurse Nathan has found an unexpected package left anonymously on the clinic doorstep.
You are destined to actually be a pigeon, aren't you, sweetheart? Oh. Generally, as a vet practice, we see mostly dogs and cats, but we are open to all creatures, great and small, and sometimes we're quite surprised by what walks through the door. And today, Nathan's brought down some very small baby pigeons. Hello. Did your mum forget where she put you? Did she? Eh? Right now, I'm quite concerned for these little baby birds. They have been exposed to a lot of stress. Their immune systems would be weakened, and obviously without mum, they have lesser chance of surviving.
So how old do you think they are?
Oh, they're young. So start to get some of their feathers though, so I'd say a few weeks, yeah.
Still got the little egg tooth, hasn't they, at the front?
Yeah. Oh, I know. Should we give you a little bit of food, eh? These baby birds need really intensive treatment and care. They need to be fed about every 3 hours around the clock, just as mum would. Here you go. A little bit of food. We're using some baby porridge, which has some long-chain carbohydrates in it. It's a good form of sustenance for a baby bird and warms them up a little bit as well. I know, yeah. There you go, have that. Good bird. Well done, that's it. Here you go. Is that delicious? Yeah.
Ooh, yummy, yummy, yummy. Well done, well done, well done. Hey, how's that? Has that made you happy?
Feeding these little baby birds is quite a delicate process. They do seem to be taking the food quite well, and you can see immediately that they are responding, they're brightening up, and they seem happy in a warmer environment.
Okay. Wow. Hey?
Oh,
goodness me.
I like the fur on the back there.
Sort of the yellow afro you've got going on there. Come on then, you. Let's feed you up. Eh?
With the little birds responding well to some warmth and food, a volunteer from London Wildlife Protection is on their way.
Still worthy of a chance, aren't you, gorgeous?
It's always lovely when the public bring in wild animals for us to look after, but so often they should just leave them alone. The mother generally knows exactly where they place their babies, and if you don't touch them and put your scent on them, they will come back and look after their own babies. Hey, Chris, thanks for coming so quickly.
That's all right, no problem.
As is the season for baby animals, I've got two...
Oh dear, they are babies, aren't they?
Yes.
Indeed. Excellent job.
Thanks for coming and rescuing me.
That's all right.
You're a good man.
Pleasure. That's what we're there for.
Now that we've fed the babies up, I'm really hopeful that they will grow into full-blown, beautiful pigeons. They've had a very tough start in life. It's a tricky road for them to go down, but hopefully they'll be fluttering around the skies of London soon.
Okay, then you two. You little kitties, aren't you? Good bird. That's it.
They got a good chance, haven't they?
Nice one. Thanks for dropping
Thank you very
by.
much.
See you later. You look after them for us.
Cheers.
Cheers.
See you again.
Bye.
Bye-bye.
The little orphans will be taken care of until they're strong enough to be released into the wild.
Bye, guys.
Right, champ, how you feeling? Are you a good boy?
Jack is fully recovered from his anaesthetic, and now it's time to go home.
Let's go and see Mum. Good boy.
Hope he's doing okay.
It's been an anxious wait for Jack's owners Francine and Joe.
Hi, guys. Here's your boy.
Hey!
There you go.
Lucky! Hello! Hello! You happy little thing.
Oh, thank you so much.
He's doing good.
Oh, God, I'm so relieved. I've never been so nervous. It felt like the longest few hours of my life, but I'm just so relieved to have him back to normal. He's a little bit dopey, but he looks really good.
So, as you can see, he's looking quite svelte now. He's lost a little bit of weight. Do you want to see what he lost?
Yeah.
I warned you.
Got a strong stomach, it's okay.
So there.
Wow.
Wow.
Oh, poor Jack.
So they're just fat?
Just fat.
Yeah. To have that much weight on either side of one joint, you really understand why he was struggling and why it was having such an impact on him. Must have been really making him uncomfortable. So he's going to be so much happier now.
All right. You going to get up? Time to go. Come on, then. Come on, there you go.
Have a proper birthday
Good
party now.
boy. It's still a pretty rubbish birthday present. He couldn't even have a cake, bless him. I have to give him one. Bye, Jack. Oh, he's very keen to leave. See ya.
Bye.
A nice old boy.
Here we are.
Luca and Trish have arrived at Scott's Isleworth clinic with a special little passenger.
Hi. We're here with Pepe.
Where is Pepe?
He's in the bag.
Oh, let's see him.
There he is.
Hello. Oh, look at you. Should we have a cuddle?
Little guinea pig Pepe is unwell, so he's been booked in for an appointment.
Oh, what's all that noise?
Hi, Trisha. Hi, Luca.
Hi.
You've given little Pepe to Jeannie. You're never going to get it back now.
Wow.
You love a guinea pig, don't you?
I love guinea pigs. They're my favourite, aren't they?
Hello, mate. Hello.
Guinea pigs are an incredibly popular pet here in the UK. They're a great family pet. They're a lovely, friendly animal. They're great with kids, but they're really good also for people that don't have gardens and have a small space to live in. Come on, guys. Let's pop on in.
Okay.
Come on.
Luca and Trish are so devoted to Pepe, they've learned how to communicate with the little guinea pig.
They've got excited, which is busy, which is
It was Pepe's sounds that first alerted them that he wasn't well.
Are you a little bit uncomfortable, mate? Are you? Hey? Let's just have a little head-to-toe examine of you. If I get one of you just to hold him around the shoulders there.
So when he pees, he makes a weaking sound, which sounds a bit like... So I can tell he also hunches his back a little bit when he pees. I'm very worried about him, you know. It's like when your child is sick, you just want them to be happy, you want them to be healthy.
Are you okay? Let's spin you around. Hey, look adoringly at Mum and Dad. There we go. All right, I'm just going to have a little feel of his tummy now. Straight away he's uncomfortable at that, isn't he? Oh, you don't like your bladder being touched, do you? I mean, fair enough. If you're up for it, I think what's probably a good idea is I'll just do a quick ultrasound. We'll have a look and see if there's anything lurking in that little guinea pig bladder of yours, my friend. Let's have a little look, shall we? So, can you see that black circle? That's the bladder. So what it is basically he's got what looks like a little stone. Urinary calculi, or bladder stones, occur in guinea pigs for a number of different reasons, but most of the time it's dietary. There's lots of different foods which have high levels of calcium that people are unaware of. A lot of green vegetables, for example, so they feed them, guinea pigs happily eat them, and then they accumulate the calcium in their bladder and they lead to stones. So it's 3.64 millimetres, which is a decent-sized bladder stone for a guinea pig. And if you kind of extrapolate that out to a human, you're probably looking at about golf ball sized. So we are going to have to perform surgery on your little Pepe, I'm afraid.
Okay.
Yeah. He's not going to be able to comfortably pass that.
No, and he's uncomfortable now with it as well, so...
It's the only option.
Yeah. Yeah. I'm worried, yeah, because it's a big thing for a little animal like that to go through an operation.
You need to say goodbye to your little guy now, because I need to take him downstairs and get that stone out.
All right.
Chap.
Good luck.
Good luck, little fella. Be a very anxious few hours, I'm sure.
Hello, ladies.
Hello.
Got little Pepe with me. Here you go, look.
Hey.
There's my rhyming team of Gina and Tina.
Yeah.
There they are.
Oh,
Hey.
your little paw.
It's time for the operation to remove a bladder stone from 3-year-old guinea pig Pepe.
Okay, here we go. Good boy. Good boy. Guinea pigs, they are quite prone to stress and they are nervous, very delicate creatures. So, of course, everyone's a little bit nervous today. You're all right, sweetheart. We use the anaesthetic gas in a box, so Pepe goes in there and hopefully goes down nice and quickly. So if you take the lid off, and then Tina, if you lift him out for me. That's it.
Good boy. Small mammals are generally very fragile when it comes to anaesthetics, so we have to take extra precautions and just be as fast as we can.
So I'm cutting now, okay?
Yep.
Oh, sorry, just flinched a little bit there, so you just turn him up.
Put him on 4.
Yep. So there's his bladder there. It's quite large, very thick, very angry bladder. Once I cut through the bladder, I then go on a little bit of a fishing expedition. I did used to love fishing as a kid. Take yourself off and enjoy the sights and sounds. I think it's good for a kid to learn a bit of patience, you know, as well. Oh, there he is. Yep. There you are, you naughty thing. It looks pretty tiny on my finger, but for a guinea pig, that is pretty large. So I think it's going to make this little boy much, much more comfortable.
Well done. When Scott pulled the stone out, initially I thought, wow, that looks really small. But if you think about the size of the guinea pig and then the size of the stone, that bladder stone is relative to a golf ball sized bladder stone in a dog or cat.
Now I'm just popping his bladder back into his abdomen where it belongs, close him up, back home to mum and dad. Tina and Gina have done fantastically well monitoring this very delicate creature very closely to ensure he gets through it. Let's wake him up.
You're now stone-free, Mr. Guinea Pig. Let's have a nice, smooth recovery, please.
A stone lighter.
Yeah.
Pepe is woken up very well. So now it's time for me to call Trish and Luca and give them the good news. Come on, little man. Let's get you back to bed. And I'll call mum and dad. Good boy. Hello, buddy. I think I heard them upstairs. I think your lift's here. Hey, come on then.
Later that day, guinea pig Pepe has recovered well from his anaesthetic and is ready to go home.
All right, let's go.
When Scott rang, I was so relieved. I had such a heavy heart all afternoon, I couldn't eat. So, yeah, I'm happy to be here to hopefully take him home.
There you go.
Hello, little boy. Hi, mister.
Say hi. Lovely day at the spa, getting some massages, losing a bladder stone, that sort of stuff.
Aww.
And all I would say is, in future, to try and prevent this from happening, is to try and consider just reducing everything that has calcium in it to a degree. So focus more on the hay and less on the pellets. I think that we should get a really good result here.
All right, will do.
Hey, come on then, you come to me. You've got a bag there from Luca, as always. Come here, sweetheart. Good boy. All right. See you later. See you later. Be a good boy. Back in your bag. There you go. Good lad.
Thank you very much.
No worries, my pleasure. See you later. Hello, guys.
Who's that?
A lovely, relaxing family picnic.
Yeah.
Hello, my boy.
And
How are
Scott
you?
now has a special belated birthday surprise
happy
for
enough.
Springer Spaniel Jack.
Great to see you. How you guys doing?
Good, thank you.
All right?
Yeah.
The elderly dog has recovered well from surgery to remove fatty lumps that were inhibiting his movement.
Well, I know that I kind of ruined his birthday a little bit. So I've bought him a little birthday cake. I'm just going to show it to you, but you can't have it just yet. Yummy.
Lucky boy.
Now, before I give you my treat, can you give me mine? I just want to know how he's gone after the surgery.
He's doing amazingly well, yeah. It's fantastic.
Yeah?
Completely changed him.
When I'm taking Jack for a walk now, he can keep up with all the little puppies and he just seems so much freer and happier.
The weight off his shoulders and a weight off our minds, really, yeah.
What I would quite like is to see him move. So if it's okay, I might pop myself over there. I'm going to offer him up his cake and then we'll see you run. I'd love to see you run and move, my boy. I did feel quite mean in not letting him have any kind of birthday cake or treat before the surgery because we need to starve him, of course, to get that done. But now is another day. He seems a lot happier, so I think he's deserved his birthday cake. All right, my boy, you ready for this? Okay. Happy birthday, buddy. Come on, let's see you move. Oh, wow, look at you go. Look at you go. Jack is a Springer Spaniel who loves his food. So, of course, he's going to want to scoff the food straight away. But the good news is he's running very smoothly, very comfortably. This is a happy, healthy boy.
I don't think I've ever seen him enjoy food as much as that.
He's so happy.
Look at that, eh? You can have your cake and eat it now, can't you?